Hello, and thank you for joining us for a quick discussion on workplace safety and health, as you can see. My name is Aaron Bankett. I'm a occupational health and safety professional working with the Safety for Nonprofits organization. And today we're going to spend some time talking about workplace health and safety and why it's important to you and your organization. We're going to spend the next little while talking about workplace safety and health, talk a little bit about Safety for Nonprofit, what it is, and how it might be able to help your organization. Different types of common safety hazards and steps that you can take to assess and control those workplace hazards that you might have in your workplace. So a quick slide on Safety for Nonprofits. Safety for Nonprofits is obviously a nonprofit organization with the vision of helping organizations keep their workers and those who are volunteering for them safe. This is employees, this is volunteers both. So people volunteering and giving back shouldn't get hurt when doing good is really what we believe in. It's important. The things that you do in your organization are important, and it's important that you keep people safe so that they can help you accomplish your objectives and your goals. So that being said, let's jump into safety and why we care about safety. Whether you're a nonprofit that works a food bank or volunteering with individuals through different services or doing cleanup work. Every so often we hear that there's somebody that is injured doing this type of work. You can see some examples here on the screen, whether it's somebody getting hit or unfortunately hit by a car, or somebody being hurt as they're out doing some work in the community or volunteering at events. These activities happen, unfortunately, and fortunately they're not as common as you might well, they're not as common, fortunately, or you certainly don't hear about them as much as you do other injuries that make the news. But nonetheless, these are impactful incidents that not only affect the individual but also affect the organizations that they happen to. If we look back over the last few years, this is a chart that's so quite dated at this point, 2003 to 2007. But nonetheless, it kind of shows the types of events and the types of industries, the types of accidents that happen. And you can see that if we look at the data, total volunteers and paid volunteers, it's really the same. People, unfortunately, will get hurt in the workplace in for-profit enterprises as well as for nonprofit organizations. So a lot of times, the activities that are being done are the same, whether it's a nonprofit or a for-profit. So you would expect that those incidents would happen for nonprofit organizations as well. So one volunteer worker per week dies while performing work. This is tragic. This is unfortunate, and it's certainly preventable. And that's what Safety for Nonprofits is wanting to help you with, is to prevent these injuries in our workplace. So the question we ask ourselves, and what you ask yourself, hopefully, is, what is safety to you? Is safety nobody getting hurt in your operations or your enterprise? Is it no accidents or no near misses? Is it eliminating danger and eliminating risks? Is it avoiding errors? These errors are mistakes that cause safety incidents, or these are errors that result in other operational issues as well. Is safety simply compliance with regulations? What does safety mean to you? That's important for you to decide in your organization. What does safety look like? What is it? Why is it important to you? As we look at the different types of hazards, the different type of safety hazards in nonprofits and industry, we can kind of divide them into several different groups here. So, for example, you might have just general safety hazards like slip, trip, and fall incidents where you have wet floors or things on the floors where somebody might trip over something and hurt themselves. You might have biological hazards if your organization works with infectious material or something of that nature. You'd also have physical hazards like electricity, or potentially somebody or some buddies who are working out in the heat or in cold environments. So you have environmental effects as well, or perhaps it's even moving objects like you see ergonomics hazards here. This is pushing and lifting and bending, how we interact with the objects in our workplace. Do we have large boxes and pallets that need to be moved? Well, these are things that a lot of times people will take on themselves or will be expected to move that can potentially cause an injury to themselves. And then last but not least, we have chemicals in our work, in our workplace or in our organization. And a lot of times we think of chemicals as chemicals in large drums or storage tanks, but these could be simple chemicals as well. These could be the things that are under your kitchen counters or in your bathrooms to clean or to wipe down different activities or processes. So the nature of chemicals can be large quantity, small quantity, and the different hazards associated with those types of chemicals. So if we look at all these types of chemicals, or I'm sorry, all these different types of hazards, and we say, boy, you may have one or more or several of these different types of hazards that your people are exposed to as they're moving materials, or if they're out walking in different areas, or maybe they're off-site working in an unfamiliar space. These are hazards that you might need to be aware of, that certainly your people might need to be aware of as they're doing these different kinds of tasks. And so for the next few slides, we're going to talk about an assessment process. There's a 5-step assessment process that will kind of walk you through collecting the information, conducting inspections, investigating injuries and illnesses, conducting a risk assessment, and then most importantly, identifying and controlling those hazards. So it's important to recognize it, but most important it is to control those hazards. So if we take a look at the first step, collect and review information to identify hazards. These are things like what type of equipment and machines do you have in your work area? Are they forklifts? Are they cardboard recyclers? Are these different types of packing stations? Or what type of equipment do you have? You look at the safety data sheet, the chemical safety information. What kind of chemicals are you using? The SDS or safety data sheet will give you that information in large part. You look at accidents. What's happened in the last little while, in the last year or so at your site? Have you had any near misses? Has somebody almost been injured at your site? This is all information or free learning that you've got that you can act on to prevent it from happening again. You may have existing safety and health programs, or you might have programs that you might be able to leverage to help operations run a little more safely in your organization. And then last but not least, obviously, when you ask, you will get feedback. So whether it's through directly talking with volunteers or with people who work in your organization, whether it's formally or informally through surveys, you really would be amazed at the kind of feedback you'll get. The people that do the work in large part will really understand or recognize a lot of times the hazards that they're working with. The second step is to conduct an initial and a periodic inspection. When you see the hazard, when you are out in your work environment, again, whether that's say within the 4 walls of your building, or whether that's out at a job site, or whether that's at somebody that you're servicing through your organization, what you can learn just by seeing it is amazing. What you might see might be something that has been recognized and has been brought to you in the past, or it might be something totally new. But putting your eyes on the process and really looking at it with a safety lens can be very helpful. As you walk your workplaces, you're looking for safety hazards, safety and health hazards. They include your workers. Kind of on the previous slide, we talked about asking for others' thoughts. Well, including others in your facility, in your area walkthroughs is very, very important, as they will see things that you might not see, and vice versa. If it makes sense and it would be helpful, then feel free to take a video or a picture of something that you might be able to show others, or perhaps show somebody who might be able to help you with a specific issue. And write down your observations, and then discuss the observations as a team. What do you see? What did you find? What might some potential solutions be? So when you're doing your inspection, it's good to have more sets of eyes looking for different types of hazards in your workplace. And the nice thing about having more people look is that everybody's context and experience is different, and so they'll bring that to bear with them as they're doing their inspection. The third step is to investigate identified safety and health concerns. So as you're out and you're looking at your facility, you may see things that you think should be corrected. So it's important, whether that is something that you've seen where that's resulted in somebody unfortunately being injured, or almost potentially causing an injury. These are things that we want to follow up with. We want to develop plans and procedures to help these things not happen again. The third bullet on this slide is important. Emergency or non-routine conditions. These may be things that you're thinking about in your facility that don't happen very often, but if they were to happen, they might be quite severe. So these are things you might want to consider as you're thinking about your facility. The fourth bullet about investigative techniques. For professional health and safety practitioners, there's a lot of different safety investigative techniques, and Safety for Nonprofit can help you with some of those. But even just a simple technique as far as asking why something happened, and then asking why several times to get to what we call a root cause. Identify and analyze the root cause. If you can find that root cause, typically you can many times prevent that from happening again. And that's really the focus that you want to have, is to eliminate the hazard. How do you prevent an incident from happening again? And a lot of times that comes from finding that root cause, or finding the cause of that and removing it. And then the nice thing to do, more than a nice thing, if you're going to build a safety culture and build trust, communicating the results back to your team, help them understand that not only were they involved in seeing hazards, recognizing hazards, and hopefully potentially weighing in on some of the solutions, but they can see that those hazards are being removed in the workplace is very encouraging, and helps build trust and engagement with your employees, volunteers. The fourth step is to assess the risk. As I mentioned earlier, there may be some things that happen, or some non-routine things that potentially could happen. Maybe they're quite severe, but they don't happen very often, or maybe they're very common, but they're not real significant. When you look at a risk, you look at something that can happen, and then you look and say, okay, well, if something were to happen, how severe would it be? We're kind of looking at this equation here at the bottom of the slide. How severe is it, and how likely is it to occur? And if you can look at both of those criteria, that will give you a risk, and you can use that risk to prioritize the different hazards in your workplace. So how bad is it? If something were to happen, how bad would it be? And then how likely is it to happen? So for example, if you had a forklift in a warehouse that was loading and stacking, or even removing material off of racks, how severe would it be if somebody walked underneath an elevated a forklift with elevated forks, an elevated pallet, and something fell off the pallet and struck them? And that could be quite severe. And you say, well, okay, well, how likely is it that would happen? Well, potentially quite likely, if you don't have any controls in your warehouse, and people kind of walk near these types of activities. If you notice some of the home improvement stores, when they have forklifts going down aisles, they have people on both sides of the forklift with flags kind of keeping people out of the way. There are some things that you can do to reduce the likelihood of something happening, because the severity can be quite high. And so this is something that will, as you look at your environment, your work environment, your warehouse, or the different tasks that you have your people doing, this will give you a context to really kind of prioritize. A lot of times we don't have the time or the resources that we need to address everything, so we have to prioritize. And this is a way, by looking at this, the severity and the likelihood, that we can help prioritize the types of activities that we should address first. The next step, as we talk about addressing these activities, leads us to selecting the controls for these hazards. And on the screen here is a hierarchy of controls, hierarchy of safety controls. And it's an inverted pyramid, as you can see, the top level being elimination, all the way down to the bottom where we have PPE. So the idea is that at the top, you have the most effective controls, and at the bottom you have the least effective controls. So for example, if you had a hazard, let's go back to our forklift example. If you had a hazard where The hazard is you've got a forklift that is raising a pallet up into a pallet bay in a pallet rack, and you've got potential people walking underneath the forklift while it's doing that. So the best thing to do would just be to eliminate it, to eliminate that task if possible, or eliminate the potential for that person to walk underneath that forklift while it's raised. So that would be kind of the first step, is let's just stop it from happening in the first place. Let's just get rid of it. Secondarily, substitution. So that would be in the example again of our forklift. If we couldn't eliminate it, perhaps we wouldn't. An option for substitution might be perhaps we don't put the pallet on the top rack, but maybe it's on the second rack, or perhaps we have a way to prevent people from coming into that area, which then leads us into engineering controls, which is something that physically prevents something from happening. So the hazard is still there, but let's say we put up barricades as an example, fixed barricades or something that prevents people from coming into a certain part of the warehouse. It could be locked doors, it could be guarding of some kind, it could be a different engineering solution for your specific hazard. And then towards the bottom, you have administrative controls and you have PPE. Administrative controls would be, say, preventing or prohibiting people from being in the warehouse or in that specific part of the warehouse when the forklift is operating. So the hazard is still there, it still exists, but administratively, you're trying to prevent people from being injured by making a procedure or a rule. And then PPE is obviously something you would wear. Or something that you would use to prevent injury. So in the case, in the forklift example, perhaps that's not the clearest example because maybe I suppose you could wear a hard hat or something as a protection from falling objects. However, that's still probably not the ideal solution. But PPE would typically be things like safety glasses and earplugs and perhaps a respirator or something, depending on what operation you had. So once you identify the hazards, you plan to remove them, you do your risk assessment to find out what you should prioritize, and then you come here to this slide where you're looking at how do you remove the hazard? How do you get rid of that hazard? And again, ideally is you get rid of it, you eliminate it at the top, and if you can't, then you kind of work your way down the hierarchy of controls through this pyramid until you find the solution that is feasible and works for you. So just as a quick exercise, if you look at this, this is just an excerpt of maybe not a typical workplace to you, but maybe a typical workplace, obviously in a construction area. And we look at this just to identify some of the hazards in this area. So, you may or may not have a man lift on the left in your operations, but you might have people that have to work at heights. Maybe they go on a roof, maybe they climb a ladder. Same with number 2, you might not install scaffolding, let's say, in your operation, but you might have people again that work at heights. Number 8 there, directly below that towards the bottom, you might be going into confined spaces. But if we just think about that also, you might have opportunity for if we're moving material, like this gentleman here is passing a wrench to somebody that's in this space. What could happen? Well, the wrench could fall and could hit somebody in the head or something. So there's different types of hazards. Some of them are significant, some of them not as significant. But if you kind of look at this, you kind of see, well, okay, I can see in a construction site, it's pretty obvious. Perhaps in your operation or your setting, it might not be as obvious. And again, Safety for Nonprofits can help identify some of these areas and help control and protect some of your volunteers and your workers. So if we look at what hazards you might have in your organization, you think of, do your people drive? That's a very common. If we think of auto accidents and injuries from auto accidents, that tends to always be on the list of ways, most common ways that people are hurt. So if you got people operating vehicles or forklifts, that's something that you're going to want to be aware of. Working at heights, again, scissor lifts or aerial lifts might or may not be something that your organization does. C, ergonomic concerns, ergonomic hazards from lifting, bending, twisting. A lot of times when you've got people moving and pushing and lifting things, that potentially is a concern. So we want to look at how we can, again, eliminate those types of activities, or at least reduce the severity of or frequency of those. Repetitive motion, electrical hazards. Electrical hazards don't necessarily need to be industrial type electrical setups, whether it's equipment, large equipment. I mean, these could even be small things like plugging in, kind of handheld equipment. What kind of shape, what kind of condition are your handheld tools in that are plugged in? These are things also to be aware of. So again, the scale can be quite wide, whether it's a very industrial setting or if it's more of a mild, more of an office type of a setting. Hazardous materials, heavy equipment, hand tools, sharp objects, working outside and outdoors, especially in hot or cold climates, or perhaps going in and out of freezers, other things to be aware of. When you ask yourself, well, I've got other things that haven't been on this list. Well, that's great. I'm glad you're thinking about it, because we really need to be thinking about it. The last one I think is a little concerning. If you're saying, well, I really don't know what I have, or I haven't seen any. Well, I suspect there's probably some that might exist that you may not be aware of, and so that's kind of one of the intentions of this presentation, is to help you become more aware of those types of hazards that you can identify. And again, the objective of Safety for Nonprofits is to look at those kinds of things and assist you in your operation, in your organization, identify and correct some of those things. So let's do a quick exercise. What type of hazards controls do you need to have at your nonprofit? So we look at this and we say, okay, we've kind of walked through the process, the 5 steps of identifying the different hazards and assessing them and prioritizing them and working through the hierarchy of controls to find a control that will eliminate it or certainly prevent the likelihood of somebody being injured. So we ask ourselves, do we have training for people who are doing certain tasks? If people are working with forklifts or equipment, or moving objects or driving, is there a certain type of awareness training that they might need, awareness or more specific training that they might need as they do these certain kinds of tasks? Let me ask ourselves, is the training documented? Has it been completed by everybody that should complete it? And do we know that? If we're working with chemicals, do we have a safety data sheet for the chemicals that are on site? And are the safety data sheets current? Do we know that only qualified personnel are performing certain work? So if we say, hey, we've got some high hazard operations at our site, if those are working in a man lift or working on the roof or operating a forklift, or some things that you might feel might be a little more hazardous than others, we want only certain people to be authorized to do those certain things. Well, they're going to need to be qualified and potentially trained a little more than others who are doing those kinds of things. Are there ways to make things easier? Processes? Can we use equipment to help people move things so they're not doing it manually? Do we have PPE to protect against certain hazards in the workplace? And then do your employees, do your volunteers know what to do if they become injured? Do they know who to report it to? And then secondarily, do your supervisors, if they would report that to a supervisor, do they know who to report that injury to? How does that work? How would that individual receive care? And then last but not least, is there a safety orientation for your employees and for your visitors, if it's appropriate? If you've got people that are going to be working with you who may not be, say, employees or volunteers of your organization, we want to make sure that we get them oriented in kind of what the basic safety expectations are for your site. And then on the bottom of the slide here, you can see some different resources. There's some federal resources as well as some resources from the state of Arizona and some national organizations. So in terms of next steps, and really this is kind of your homework, is if you found this information helpful, this training will be available to you, obviously, that you can go back and you can review some of these steps. You may have it totally down down pat totally, and that's fantastic. There may be some areas that you can work on or would like to improve on, and we hope that you're able to do that for your employees. And then also consider contacting Safety for Nonprofits S4NP for some free assistance in helping you with concerns or opportunities in your workplace. And again, here's the contact information for Safety for Nonprofits, and we look forward to hearing from you soon. Thank you.